if a case of COVID-19 has not been cured after several months, or severe symptoms begin to arise this late after an infection, a diagnosis of long COVID or post-COVID syndrome is made. In Germany, it is estimated that tens of thousands of people could be affected by long COVID, including many young people. The first calculations are predicting up to 100,000 patients in Germany by the end of the year 2021. Around 3.1 million people who were diagnosed with COVID-19 have officially recovered, but for many of them, that does not mean that they are out of the woods quite yet. Many have to deal with long-term effects in one form or another. There are three types of progression. Group 1, in which patients have only very mild symptoms or no symptoms at all and no long-term effects. Group 2, which has a very difficult progression, familiar to us from the pictures we have seen from intensive care units. These patients often go to rehab immediately afterward and they get appropriate treatment. And then there's Group 3. This is often seen in younger patients who initially had a mild case of the disease and who appeared to have fully recovered. After 1 to 4 months, however, they begin to show what we call rebound symptoms. This means that the disease returns in a more severe manner with more extreme symptoms. From a psychological point of view, Group 2 and Group 3 are the patients who most need our extra support and attention. The needs of the second group are about understanding the intangible reality of the situation that the outbreak of the virus has caused for them: hospital, intensive care, ventilation, social isolation, to name just a few of the stressors. For people who belong to the third group, initially having a mild case with serve rebound symptoms that follow, there are three main aspects to deal with. Firstly, understanding that the seemingly harmless case of one's own illness is now leading to a reduction in quality of life and well-being. Second, to understand that the social environment may find it difficult to accept and understand that, despite the absence of severe symptoms during the initial infection, the patient is now suffering both physically and mentally. And finally, point 3, the acceptance of the individual that even after a mild case of the disease, they will now have to deal with restrictions, challenges, and hurdles due to the severity of the rebound system. Admitting to yourself that you too, like the other patients with severe cases, are in need of good and possibly intense medical care, rehabilitation, and psychological support, this can be a challenging and somewhat overwhelming realization. Being aware of the discrepancy between the mild progression of the infection and the intense nature of the rebound symptoms is one of the first steps. Understanding that there is no reason to be ashamed or to hide feelings around this discrepancy can be a part of the psychological recovery and healing process. If you are suffering from long COVID and are feeling overwhelmed by the symptoms, I would be delighted to support you through this process of recovery.